Look, we've talked about it enough. It's time for action. We so desperately want a healthcare system where every piece of vital information flows seamlessly between providers and makes sure that clinicians have access to the right data at the right time without the usual hurdles. But instead, the reality is this persistent problem of disjointed systems where valuable patient information gets trapped in silos, leading to inefficiencies and even compromised care. Wouldn't it be nice to just go Control N on all of healthcare and start afresh to design the perfect system from scratch? But we obviously can't do that. So what are our options? How do we make sure that all of this talk and hypothesizing about interoperability actually results in, real stuff that has an impact on patient outcomes and system efficiency? Well, on the show today, I speak with Kate Ebrill from the Australian eHealth Research Centre at CSIRO and Danielle Bancroft, Chief Product Officer at Best Practice Software. Both of them are super hands-on with the Sparked initiative, which is a community comprising of government, technology vendors, provider organisations, peak bodies, practitioners and domain experts to accelerate the creation and use of national FHIR standards in healthcare information exchange. So in this episode, we talk about what the Sparked initiative is and why you should get involved, the importance of community-driven incremental improvements in healthcare data exchange, and how Australia is localising international FHIR standards to fit our own unique healthcare landscape. Collaboration starts with a conversation, Team HealthTech. Let's make it happen.
Welcome to Talking HealthTech, featuring content and community about technology and healthcare. We acknowledge the traditional owners of lands these conversations were recorded and pay respect to elders past and present.
Joining me today on the podcast, I've got Danielle Bancroft, Chief Product Officer at Best Practice Software, as well as Kate Ebrill, National Lead for Sparked. Hey team, how are we going?
Yeah, good. Good to see you.
Good to see you. Great to chat on the podcast as always. No strangers to Talking HealthTech, either of you, but I don't think we've all jumped onto the one conversation, and it's a timely one to do now as we learn a little bit more about Sparked. But perhaps for those handful of people in the industry who may not be fully aware of who you both are, I might give you both an opportunity to perhaps introduce yourself in the context of this conversation. We'll start with Danielle first, please.
So I'm here today representing Best Practice as a founding industry member of Sparked, but also independently, I've been a member of HL7, both Australia and internationally for close to a decade now. It's been a while. As a co-chair, both here on the International Pharmacy Group, as well as the Medications Working Group here in Australia. And I'm also a practicing pharmacist, although I think we're getting close to, I'm not sure if I can say practicing so much anymore.
But that's but got that background and context, so that's helpful. So keen to dive into a little bit more about your involvement in a second. But Kate, what about you?
Yeah, so I'm the lead for Sparked, but I'm probably known as a self-confessed standards nerd, standards evangelist, and have been in this space for, over 20 years, clinically trained, but worked on the first ever Health Connect trial in Tasmania back 22 years ago. Obviously, I was very, very young at the time and got sucked into the world of digital health and standards, never ever to get out again.
That's the place to be and the place where you live now, Kate. So that's important. So we're here in particular to talk about Sparked, and we've seen it mentioned depending on where you are, or maybe you've not heard of Sparked at all. So we're going to dive into a bit more. Maybe Kate, if you can tell me a little bit more about what Sparked actually is.
Yeah, so Sparked has now hit its first birthday. It is Australia's national FHIR accelerator, and really the first kind of FHIR accelerator that's been driven out of the US. And Sparked is a collaborative of bringing together government, industry, clinicians, consumers to actually develop those foundational FHIR specifications for Australia. So CSIRO has been funded by the Federal Department of Health to deliver this accelerator on behalf of the country. And it's governed with the Department, the Australian Digital Health Agency, HL7 Australia is the SDO around FHIR, and CSIRO.
You gave me 15 acronyms in about 3 sentences then, but I
it wouldn't be a digital health podcast.
And it will take 2 hours longer if we start to fill out these acronyms. And
This is
sometimes
very
that's
true.
what the acronyms mean. So, what is FHIR? That's probably the first acronym that I mentioned. And FHIR stands for Fast Healthcare Interoperability Resources. And it's actually part of the HL7 suite of interoperability standards. And for those who aren't aware, one of the key founders, leaders, known as the father of, is actually Graham Grieve, Australian from Melbourne, who back in about 2011 said there has to be a better way to look at standards to enable interoperability. And we have to start to look at modern technology and modern standards that leverage the web, that any graduate that comes out of university can actually start to pick up and use these standards. And, that really where it comes into FAST, being healthcare specific, all about interoperability and kind of reusable resources that start to underpin. And it's something that was driven and mandated within the US under the 21st Century Cures Act, a lot of uptake globally. And within Australia now, we're really trying to coordinate that effort and make sure that we take those international standards but localise them for use within Australia and make them fit for purpose for use within Australia.
Yeah, got you. Because I guess as I've followed along the FHIR journey, and Graham's been on the podcast a few times, and in the really early stages of Talking HealthTech, which is already well on his pathway with the FHIR standard. Like one really strong piece around FHIR is community, where a lot of people kind of come together and share. But this is quite different than is like when I think about the FHIR community generally, where everyone kind of comes together and works out what this looks like. Is Sparked kind of the next level on that?
Yeah, what's really exciting about Sparked is we're actually building on that process around community. And Graham will always say that the value, it's not a tech issue. It's actually about bringing the community together. But importantly, we're not just bringing the tech community together. The key difference around Sparked is we're also really actively focused around bringing clinicians and consumers, government and industry to the table. Because unless what we develop is consumer focused and about improving consumer outcomes, unless it's fit for purpose for clinicians, it has to be implementable by industry and it has to align with government policy. And if any one of those four things is out of whack, we actually aren't going to end up with a fit for purpose standard for Australia.
Yeah, got you. And so that kind of already starts to answer one of my questions, Danielle, in terms of, let's say, your involvement and best practice. You've been quite involved in Sparked over the last 12 months. And obviously within the industry too. Talk to me more about, I guess, your involvement in Sparked and why that's important.
Sure. So for a long time, a lot of clinical systems have been built up independently. So we all have our own database, our own structures, our own way of storing the data. Increasingly, though, being able to actually share that data is becoming more important, particularly around preventative care and making sure that we have a more complete record of the patient, both from a clinician perspective, but also from a patient's perspective. Because you've got 20 to 30 years worth of technology that's built and everyone's got a different approach to how they've built that, it becomes a question of how do you safely, I think safety is the main thing. How do I know what the data is, know that it's the same value that I've got mapped in my system? How do we share that data in a meaningful manner that is safe and effective and efficient? And so that's where standards come in. If I can have it in a format that's known, that is the same format that everyone passes that data in, it becomes a lot safer and efficient to pass, but it also becomes a lot easier for us to innovate and faster in that I'm reusing those same standards and methods to talk to multiple different systems.
Yeah, and I think the thing is, like we always talk about, and the whole thing's been right information, right place, right time.
Yeah.
I had a fourth one in, it's right information in the right format, right place, right time, because we are about seamless exchange of information. We don't want to have to manipulate that information. We want to be able to make sure that what the clinicians put in the record is what the clinicians see at the other end and is what the consumers see without any manipulation and extra effort for industry or for clinicians around this.
And look, in an ideal world, now that we know what we know around interoperability, would we love to actually completely start from scratch and build the ideal perfect system? Sure, but none of us have millions of dollars and decades to build those systems. The reality is there are so many different things we've added to those systems. They take a good 5 to 10 years just to get to a small, baseline level of what you want. That's not even a rich product. So we have to be clear on we need the value today, and this is a way to present that data and bring the value without having to invest millions to rebuild our systems.
And I think that's one of the great things about FHIR is it is about community. It's about agile. It's about iterative. let's not perfect be the enemy of good.
Yeah.
We actually have to start to design something with the future in the end in mind,
Yep.
but progressively work towards that together.
Correct. Put that, what can we tangibly put in incremental sprints that gets us closer to the goal, right? If we try to bite off too much all at once, you never get there. But if we can actually build out, first let's get the how, then let's get the plumbing in place, then let's start exchanging data, and over time you get a better system.
I'm thinking, because in terms of the way that Sparked operates, because I've seen that there's meetups and there's things going on, and what you've just said makes a lot of sense to me. But in my own experience or perhaps for someone that might be thinking, well, if we're putting together standards, like standards sometimes feels like, well, I'm going to write out a bunch of rules and then people follow the rules. And so the work between getting to that point that you've mentioned from where we are now, like what actually goes on in those meetups or in that process? Is it a bunch of bartering of like, well, this is where we're at right now and this is what we can do? Well, no, we don't. Because everyone wants this interoperability piece. I'd love to understand like what that actually this middle bit looks like what Sparked is doing.
Yeah, and there's three design groups that we've created, and it's open, everyone can join. So that's probably one of the other key things that are different about this. This isn't going out and saying, hey, there's a select few experts that we're inviting to the table. This is completely open. Anyone can join at any point. Everything is transparent, available on the website. So anyone who's listening and says, oh, I want to get involved, but it's too late, it's already a year in. No, it's not too late. Come and get involved. And we've got 3 different ways that we engage through design groups. And there's a clinical design group, and there's over 400 people that are registered for each of these different design groups. And with that clinical design group, that's where, we get in the room 4 times a year, over 100 people in the room, mix of clinicians and consumers and government and industry. And it is that. It's getting that consensus around what actually is important. So one of the key things we're developing is something called the AU Core for Data Interoperability, AU CDI. And this is really similar to what the Office of the National Coordinator has developed in the US, where they've got a US Core for Data Interoperability and other countries are doing the same. And it's about everyone getting in the room, and to the point of, it's not about everything being perfect and it's not about doing everything all at once. It's what's this core information? And Dr. Chris Moy, who's one of our clinical leads, will say it's about the core of the core. What is the absolute information that is important that we can seamlessly exchange between systems, that's of value to the clinicians to record, that's going to have meaning for consumers, that's that value information that needs to go to the next clinician in the care chain, and that it's actually easy and ready to be implemented now or with little extra effort by the industry. And that's what's so valuable, that we get all those voices in the room, because it is working that out. It's saying this is what's actually important from a consumer perspective. This is what's clinically important. Hey, Danielle, what do you currently do in best practice? Is this actually feasible? Is this something that can be supported now? How do we tweak this? Because there's no point us dreaming up perfect and then it being 3, 4, 5 years away from being implemented. This is about this kind of agile, iterative, get releases out within kind of 6 to 12 months max, those releases being usable by industry and value starting to be presented back to both industry, clinicians and consumers kind of within that short time frame, or otherwise we lose interest. This has to be something that we're actually building on incrementally each time and adding value. So the clinical group gets together, but the clinical group means everyone's at the table. And then that is kind of defines the what. What's the important information? What do we actually all agree and say has to be that information that's seamlessly exchanged? And then the technical design group comes together and they say, right, how do we do this? How do we actually do this in FHIR, and how do we make this work? And it's a lot of backwards and forwards and discussion and debate, but probably the great thing about FHIR, different to where some of those other standards, there was a lot of debate and not, let's move to the next step, is with FHIR we move from debate into things called connectathons, where the industry gets in the room and actually starts testing and validating that actually this specification is fit for purpose, is implementable. And right now we're right in the middle of testing of the spec, and we're running workshops. We had one in Brisbane last week. We've got one over the next few weeks in Sydney and in Melbourne, where we went out to industry for an expression of interest and said, hey, who wants to come to the table to start testing and validating the spec? So one of the key things about this is within FHIR, you need to hit a maturity level to move from a trial standard to move to something that can actually get balloted. So the standards have to be fit for purpose before we ballot them and release them out there for vendors to actually implement against. And that's one of the key things. This is practical, agile, iterative, test, validate as we go.
It's also aligned to key use cases, because there's no point in trying to pick, something that's not practical. What can we do? We're not trying to solve every problem today, but we're picking the key value ones. What are the ones that we all have that are critical to patients right now, that are critical to the government, are critical in industry, and then choosing to focus in on them first as a way to actually prove out. The example being, we've started with AU Core to support bulk upload as well as the patient summary. As primary care, one of the key or highest value that we have for our clinicians is being able to actually just pass a patient summary to a secondary clinician. So within that connected care or care portfolio, I might have a specialist, I might have an allied health professional, I might have an admission to an aged care facility, I might have an admission to hospital. All of those things have one thing in common. That's a basic understanding of what does the patient look like today at a high level, and that's the summary. So those two key values give us a really good starting or launch point to go, hey, what can we do to improve this?
And I think that's one of the key things, like AU Core and all of the FHIR experts, listening to this kind of cringe every time I say it. But in its simplest to me, the AU Core FHIR implementation guide is what is 80% of the information that I want to be able to exchange for 80% of the use cases. So if we get like that foundation right, then this allows industry to take AU Core and provides those kind of guide rails to say, while the government might be working through use cases like e-request, we know right now industry is having to support other exchange and other use cases, so they can take that AU Core implementation guide and start to make sure that at least those core data elements that might support referrals or patient summary or other things are actually leveraging AU Core. And this comes to that real thing about reusability, that common foundation that can be reused for multiple use cases. So when we exchange information about a patient, as Danielle said, or a problem diagnosis, or a medication statement or procedures, we're exchanging that in the same way regardless of what that use case is. So it gives some confidence to industry around here's how I can start to build on these things and reuse them.
Yeah, that makes sense to me that, having that those stakeholders in the room to build this kind of foundation, the standards that everything else is going to be built on top on. That's super important to have that clarity on the why and what we're trying, so that what we're building is kind of fit for purpose. Where does this fit into it'd be interesting to understand where it fits into that bigger picture then from real, how do you kind of go about communicating that why and aligning what's happening in the standard space with kind of what happened? Is there a time frame to Sparked and then it lives for a certain period of time?
Yeah, so Sparked has actually been funded for 2 years. So as I said, we've now hit our first birthday. We've got another year to run. And under that 2 years, it was developed that foundation of AU Core and also look at e-requesting. In parallel, there's obviously a lot of work that's happening through the Digital Health Agency and the Federal Department of Health. So the Federal Department of Health and Aged Care are looking at that broader e-requesting. And this is actually allowing us to work with industry and clinicians around developing those specifications while in parallel, the governments are looking at what is the national infrastructure to support this. And this is really cool because in the past, we kind of set a date and time that we were going to have something built nationally, and we kind of ended up compressing the standards piece into a matter of weeks rather than allowing a true kind of collaborative consensus-built process. So this is really exciting because we actually get that 2 years to do a proper community process while in parallel, the governments are looking at what are the national infrastructure that's required to support this, what are the policy enablers required to support this. So the key thing is that Sparked is governed by the Digital Health Agency and the Department of Health and Aged Care, and it's at HL7 and CSIRO, because that means we're putting in the context of that broader vision and strategy. And development of the FHIR specifications are one of those enablers and building blocks under the National Interoperability Plan, under the Digital Health Strategy. And so this is really providing that foundation that as the agency and the governments work forward with their plans of the national infrastructure, this is ensuring that we've got a foundation of standards of which that can be built on.
I was going to say, in parallel to that, often a number of industry have invested ahead. So what I mean by that is you kind of take a punt on where things are going to go, and it either pays off or it doesn't. So there are a number of different vendors who have been investing in FHIR for a significant period of time. They've done that in good faith, assuming that's where the rest of the industry goes. With Sparked, that provides the assurity that you need to know that your investment is actually going in the right direction. So even with Sparked, the foundations are there, it builds the community. You kind of have this parallel of we're already working in that direction. So irrespective of whether, you are ready to actually implement those IGs or standards or not, you know that that's where you need to go. And so you can invest and have that built into your roadmap. So kind of while Sparked has the 2-year approval right now, the rest of us have now got 5 years worth of development that we can sort of plan for alongside that, if that makes sense.
Yeah. And only this year's budget. So back in May, additional funding came through to continue that planning work around the Sparked program. So we started with AU Core, we looked at e-requesting, and in those use cases, supported to actually get the community to start exploring patient summary, and in the context of patient summary and international patient summary and chronic disease management. So starting to layer those important use cases on top of these foundational standards and to say, let's continue to work in this manner to develop these foundations.
Yeah, no, and I no doubt in the coming months and I guess years on the Talking HealthTech podcast, we'll unpack kind of that bigger picture too, and excited to see those stakeholders being involved in that foundation work. So that's super important. Danielle, when you mentioned about taking the punt on FHIR, I feel like that's kind of the challenge from an industry point of view of like, well, we need to build something and we need to move now. If I was taking the perspective of someone that's listening to the podcast that might be building a solution, because it's interesting too that there's everywhere from EMRs and solutions that have existed for 20, 30 years right through to new emerging technologies that are building up from scratch, some of them from within clinical settings, some of them bespoke, and everything kind of in between. In terms of Sparked and who should be most interested in being involved. Like if I'm building something now and I haven't really thought too much about, that aspect, should I be engaging and be immersed in it right now? Or is there a particular cohort of that vendor community that should really be paying attention to Sparked?
The reality is they all should. There's a lot, it's difficult to say, but the reality is this is not going away. We are all committed. There are a number of vendors at the table across the board, from aged care, primary care, acute care. As you said, some have had solutions for decades. Others have, they're fairly fresh at the table. The reality is that if you want to connect in and you want to be able to do it in a cost-efficient and standardized manner, you're going to have to be invested in FHIR. And the reality is you need to be there today to actually be able to upskill your workforce, have your internal knowledge and understanding, have those APIs available. You will put yourself at a disservice and behind in the market if you don't get to that table today. And, we have got sectors of the industry that are like, oh, it doesn't really matter to me right now. You're only talking about e-requesting. Well, the reality is e-requesting is our use case, but it's the underlying understanding that if you don't come to that table and work together and start to understand what FHIR is, it's really hard to actually build that into your workflows and roadmaps in an efficient time.
It's not a new conversation we've had in the industry, though, but I guess you've kind of unpacked a few kind of tangible things about like how this is a little bit different. If you were to if you were to go to any digital health conference or to just even a meetup and a conversation, and a lot of people you might mention, well, let's talk about interoperability. Someone might say, well, we've talked about interoperability. We know this needs to be done, but Kate, if you were to kind of crystallize how this is different now, or like you've been in this game probably, one of the longest out of everyone, but you still seem super excited about it. Maybe you're weird, I'm not sure, but what excites you the most? What excites you the most about it now, about why this is different compared to what's happened in the past?
What's different is that it's actually being supported to be a truly bottom-up, community-driven process. This is for the community, by the community, and really led in that way. I mean, to have a collective where we've got over 600 people registered to be part of something that's about developing standards, to have something where we can be truly open and transparent. But what's also amazing at it is that we don't just have this bottom-up kind of groundswell, is we actually do have the support from the Department of Health and Aged Care, plus other state health departments, plus the Australian Digital Health Agency, because it's really important where we need that bottom-up groundswell, developing something to fit for purpose, but we have also that top-down support from those that set the policy, build the infrastructure and procure the systems to make sure that we're joining up in the middle. And I feel like we've got this time where we have a mature set of standards that are actually fit for purpose to do what we want to do, that we've wanted to do back since 2000 and when we first started talking about National Electronic Health Records. With FHIR, we've actually got something that is mature, that is fit for purpose and modern in that way, that probably supports the use cases we want to support. And we have this awesome buy-in from the whole sector who, as Danielle said earlier, like people just want to get on and get it done. Like we've been talking about it for too long. Everyone just wants to get on and get it done, but they want to be part of the conversation. They don't want it done to them. It's about the community driving it and that we all actually get a say in this, but we do actually have that really active support from the governments and the agency to say that they're going to come, together. We're bringing this together with both the policy enablement, the infrastructure, and the right fit for purpose standards that are being developed. And I feel like we've just got this point in time that we've not had before to actually make it happen.
It's definitely time to jump. It sounds like it's definitely time to get involved, if not already. So that's it is that window of opportunity is here. So I encourage those that have been watching from a distance or that feel like it's probably something that's relevant to them. It's somewhere on the list to be involved. It's we'll make sure the details are here in the show notes of this episode to learn more and get active in it. It's always important, though, Danielle and Kate, as we talk about, these things in healthcare, you have touched a fair bit on the, what this means for clinicians and consumers, because it's great that we can geek out on the standard side and create, solutions that connect seamlessly to each other and create a system that's truly interoperable. But then how do we then take, let's say we nail this thing and we've got it all kind of done. What does that mean then for clinicians and consumers?
So one of the things I like to give a use case, I guess, is something we're working on right now with CSIRO in terms of the innovation, right? So what this means for clinicians is the way that they practice in the future can be enhanced to allow them to have more time on the clinical side. What I mean by that is I'm going to use as many buzzwords in this because we've already said interoperability a number of times. So we're just going to throw AI in because it's everyone's favorite buzzword as well. So what's missing in the last little bit. No, so one of the key areas I think that this really sort of highlights is what we can do to innovate for our clinicians off the back of that. So with standards comes a number of things, including terminology and being able to build out some of the terminology sets that we've not completed previously. And that includes around some of the key pieces like disease state and diagnosis. And so from that, one of the really important bits is, great, everyone's gone off and you can get a Gen AI scribe tool. I know I've spoken about this before, to go and write your notes, which is wonderful. But one of the concerns we had as a business was, well, great, now we're generating these notes, but they're all free text. So a constraint within interoperability is being able to have structured data that we can identify and map to to a structured resource that we've all agreed to. So to do that, if we're now going back a step with a new technology advancement and going, okay, well, now we've got all these free notes, let's just throw them in the clinical system, we're kind of setting ourselves back a bit in the longer term. So we're working with CSIRO at the moment to look at how we can actually use the terminology coding that when we write back those clinical notes, they're actually coded within the clinical system, which then allows us to utilize that to make better decision and support automated clinical decision supports for our users. So that's a cool area where this has allowed us to actually advance in those particular parts, where we can not only actually provide better workflows that are smarter, utilizing some of that artificial intelligence and machine learning, but we can then use the interoperability standard to code that data and share it to other systems.
Yeah, and I think that's a really important point because, AI has been the buzzword or the flavor of the month for many months and many years. But, the key thing is we need to build that on really good, solid ground truth, and having good structured data within the systems. It's twofold. One, it allows us to get the ground truth to actually build out these tools and know that they are based on good data, good evidence. The other thing is that then it allows us, as Danielle said, to then be able to say, well, how do you now use these tools to make the experience for clinicians better? Yeah. And, the fundamental thing for me around this with data and where we want to go is we're trying to make the right thing to do the easy thing to do. So in the future, there's going to be awesome innovation, and maybe in the not too distant future around this, but also similarly, just fundamentally, if the clinician enters the data in the record, let that data be reused to flow into forms, to flow into referrals, to flow into care plans, to flow into the data that's required for reporting and audit. Let's not, add extra burden to clinicians with they're currently transcribing that data all over the place. So in its absolute simplest, like single entry of data, multiple reuse, and then Danielle's actually going to look at the innovation around how to even improve that single entry of data to start with. But there's things we can do now without AI, and then it gets really exciting with the things that we can start to do in the future with AI as well.
And it comes back to, automating some of those administrative workflows reduces burden on the clinician, right? Which then also provides better quality time with the patient.
100%.
And it all flows back. So the value add, we talk about a standard, and it's all like, yeah, yawn, that's boring, great. But the reality is the downstream user experience and the actual impacts we have on the overall clinical workflow for the life cycle of patient is absolutely tenfold just by getting that data in a usable way.
And, we've been talking about the data in a usable way, which is part of the FHIR standard, but there are other parts of the FHIR standard around SMART, and then, clinical decision support hooks, which also enables innovation because you can be using a statewide EMR platform, you can be using a primary care platform, but you can also start to have value-added tools that integrate within the clinical workflow. And so these might be things like AUCVD risk calculators. It might be around smart forms. So you start to actually improve the whole experience for clinicians where they use their existing EMR. They're not having to, step outside of their practice management system, their information system, their statewide EMR, but you can start to then have best of breed value-added tools that authenticate in the appropriate way securely within those systems and integrate on the data as well. So it actually just opens up this world of possibility for tools for clinicians, but are still secure, are still built on the right data, and are properly integrated within the workflow.
So you don't get notification fatigue. Because that's the key value, right now is, hugely.
Hey, look, it's that makes a lot of sense, and it's exciting to hear that your own passion and interest in the standard side, and no doubt that kind of flows through the Spark community. So we'll have the details for Sparked and CSIRO in the show notes of this episode for people to learn more and understand how it fits into that broader ecosystem, what it means to you, because it's like you say, it's happening right now, and it's a good time to get in so that we can kind of really build for the future. So Danielle, Kate, I really appreciate you making the time to come and have a chat. Thanks so much.
Thank you.
We hope you enjoyed this episode of Talking HealthTech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.